A very good afternoon, students. This is the video regarding the Viva questions on the mandible. I will try to just put very important questions which are usually asked by the examiners when you are given the bone mandible. Now, these many illustrations which I am going to show you, most of them they are taken from my own book Human Osteology, which was published by the PP publisher New Delhi, and I am thankful to them for using this illustration. Now, the whenever you are given a mandible in the examination for the Viva, then he will ask you how to hold it in anatomical position. It is very easy to hold the mandible in anatomical position. Just keep it horizontally. The body of the mandible should be kept horizontally and in the midline. Okay, that means towards the median plane. Just it is very simple. Then the question will be, what are the parts of the mandible? If you will see the parts of the mandible, where I am moving the pointer in the first illustration, just see here, this part of the mandible is called as the body of the mandible, and the posterior most part is called as the ramus. There are right and left rami of the mandibles are there. This is a quadrilateral bone. The ramus is, while the mandible body is an R-shaped structure. Now he may ask you, what are the borders of the body of the mandible? Then you can say that the superior border of the mandible, which bears the teeth, is called as the alveolar process. Okay, that is called as alveolar. While the lower border of the mandible, which is almost rounded, okay, this is called as the base of the mandible. Then the question may come from the examiner side that what is the junctional line between the ramus of the mandible, okay, and the body. You say that if we draw an imaginary line anteriorly onto the ramus of the mandible, then it will be a junctional line between, or demarcation line between, the body of the mandible and that of the ramus of the mandible. Then the question will come, how many surfaces and borders are there in the body of the mandible? You say that there is an external surface, and in the second diagram you are seeing the internal or inner surface of the body of the mandible. Similarly, for the ramus, you can answer that there is an external surface of the ramus, and then this, where I am moving my pointer, this is the inner or the internal surface of the ramus, which is a quadrilateral bone. Then from the upper end of this ramus of the mandible, the two bony processes are going. He may ask you the name of these two bony processes. What is the name of this triangular bony process? You said that, say that it is coronoid process, while posterior process is the this condylar process. You call it as condylar process, and the upper end of the condylar process is the head of the mandible. And then he can ask you which joint is formed by the head of the mandible. You reply that it is the temporomandibular joint or TM joint. Okay, and on this joint the mandible moves for the various act like mastication and also in the speech. Okay, now then he may ask you what are the foramina in the mandible. Then you say that in the body, on the external surface, this foramina which I am pointing is called as the mantle foramina, while on the inner aspect of the ramus of the mandible there is a foramina which is known as mandibular foramina. Just see these two mandibular foramina on this rami. This, you can see this mandibular foramina is the beginning of a canal, what is called as mandibular canal, which opens onto the mantle foramina outside. Okay, a bony process is on the medial surface or medial and superior medial and anterior surface of this mandibular foramina, and this bony projection is called as lingula. Okay, it is called as lingular process or rather. Then he may ask you what are the other bony features on the body. You can say that in the inner aspect near the symphysis menti or midline there are four tubercles, two on either side of the midline, These are the tubercles which are superior and inferior genial tubercle. Two superior genial and two inferior genial tubercle. Then a question may also come that show me the angle of the mandible and where it is located. In this diagram you can see that this is the posterior border of ramus and the inferior border of ramus. Where they meet, there is the angle of the mandible. In most of the mandible belonging to male, this angle of the mandible is everted outside. So this is the angle of the mandible. Then he may also ask you, show me some of the mylohyoid groove. Then on the inner aspect of the ramus from mandibular foramina, you can see where I am moving my pointer. This is the mandibular or the mylohyoid groove is there, and just above there will be a line which is called as the mylohyoid line. This many may be the can you say questions which can be asked onto the mandible. Then we go to the various soft tissue relations of this mandible. Then he will ask you what are the attachment of the muscles, where are they, and important muscles which are attached to mandible are the muscles of mastication, that is temporalis, and you say that the temporalis attached to the coronoid process mostly at its apex, anterior border and on medial surface. See this in first diagram, it is attached onto the anterior border but major portion is attached onto the medial surface of the coronoid process. Okay. Second muscle of mastication is the masseter, and you can say the masseter is attached onto the lateral surface of the ramus of the mandible, right, extending right up to the angle of the mandible, this area. The third muscle of the mastication, you show him that it is the medial pterygoid muscle which is attached on the inner aspect of the angle of mandible and just an area above on the ramus. Okay, so this is the area for the attachment of the medial pterygoid. The fourth muscle you have to show and this is attached onto the neck of the mandible, anterior aspect of the neck of the mandible where pointer is moving. There is a depression called as fovea, and in this fovea the tendon of the lateral pterygoid is attached just below the head of the mandible. There will be a pit. You can just find that pit with the help of your finger. Okay, with the help of the finger. These are the four important muscles of mastication and they will definitely be asked from you. Then he can also ask you where is the attachment of the mylohyoid muscle, and you can say that it is attached on the inner aspect of the body of the mandible on the mylohyoid line. So this line where I am moving the pointer is mylohyoid, but on outer surface you can show that on the oblique line there is the attachment of the buccinator muscles. I think this many muscles, if you know their attachment, it is good. Okay. And he may also ask many other questions. For example, he may ask what are the attachment of the ligaments. Okay, I will say how many ligaments are attached and where they are attached. You can show that the ligament which is of temporomandibular joint, which is called as the lateral ligament of TM joint, is attached onto the neck of the mandible, which is not seen in this diagram because it is from inner aspect, okay, of the ramus, inner surface of the ramus or medial and inner surface of the body. So it is attached onto the lateral surface of the neck of the mandible is the attachment of the lateral ligament of the TM joint. Then this ligament which is attached to the lingula or lingual process of the just onto the medial side of the mandibular foramina here on the inner aspect of the ramus of the mandible, this ligament is called as sphenomandibular ligament, which extend between the spine of the sphenoid from the base of the skull to this mandibular foramina, okay, to the lingual process here. So this is sphenomandibular, second ligament. Then third ligament you can show, that is called as stylomandibular ligament, which comes from the tip of the styloid process and is attached to the angle of mandible and posterior border of the ramus of the mandible, close to that angle. This is stylomandibular ligament. Sometime he may ask any other ligament, then you reply it is pterygomandibular raphe. Okay, this is that which is attached just posterior to the third molar teeth on the anterior margin of the ramus of the mandible. Then he may ask you relations of the gland. This inner aspect of the body of the mandible is related to the two important salivary glands. One is sublingual and another is the submandibular. Where I am moving my pointer, there is a fossa, that is the sublingual fossa, where you saw that there is the sublingual gland related, and below near the lower border it is the submandibular gland is related just below the mylohyoid. In between, I am say the mylohyoid line is in between these two glands. Okay, the attachment of the mylohyoid muscle, it is the attachment of myelo. Then he may ask, what are the nerves which are in relation to that of the mandible? You say that many nerves are directly in relation to the mandible bone, and this is the masseteric nerve. Where my pointer is there, this is the nerve to masseter along with the vessel or the artery to masseter, which is in the mandibular notch, which is between the head of the mandible and coronoid process. Okay, then there is a nerve which is related to the posterior aspect of the neck of the mandible, and this is auriculotemporal nerve. It is auriculo. Then you can show that the inferior alveolar nerve is going inside the mandibular foramina into the mandibular canal and will come out as the ventral nerve on the outside of the body. But before it goes inside the mandibular foramina, it gives a branch what is called as the mylohyoid nerve. Similarly, there is an artery which is related on inner aspect of the ramus of the mandible just below the neck of the mandible. This is the important artery, the maxillary artery, and this gives the inferior alveolar artery which goes along with the inferior alveolar nerve into the mandibular foramina. So these many nerves, blood vessels and the ligaments are in relation to that of the mandible. I thank you very much for watching this video on the Viva on the mandible. I suppose that I have covered almost all the usual questions which are asked for the Viva on the mandible. Once again, thank you very much for watching this video.